Good day. I'll try in this video to explain why OCD feels so real, or how OCD feels so real. I will use, I have explained that before, but now I'm using more because I assume that you are now advanced in the therapy after all these videos. So I will use some emotional terms. Okay. Uh, okay, we have two components: long-term component, long-term construction of the OCD self, and sudden or short-term. But first I will explain the long-term construction. Uh, you have ambivalence. You are scanning the environment. You expect uh, after so now you have OCD. You expect that when you approach or you become near your values or anything that is really important for you, you expect to get happy, to get good feelings, to get supported, okay, to get positive feeling. But now the problem with OCD is that when you are uh, approaching your value or you get triggered by an obsession, uh, you need these feelings. You need the feelings of fulfillment when you approach your value, when you are doing something important for you, or you are near something important for you. You need fulfillment, and you expect a feeling of fulfillment, especially from approaching these important things, important values for you. But what is happening is that you are deprived. You are deprived from your need. You are deprived from your fulfillment. This deprivation of the fulfillment, especially where your values are, this deprivation of good feeling, this deprivation of expected good feeling is very painful. So now you have the pain of not fulfilling, and you have the pain of bad expectation or pessimistic expectation when you are approaching your values. Now, when you think about OCD, when you uh, get triggered, when you have an obsession, and you feel deprivation, then this is pain. Pain. Our brain had learned through all these years anthropologically to consider pain as a real thing. When you feel pain, when you feel fear, when you feel pain, when you feel fear, then our brain has learned all these millions of years, learned to respond. And the brain cannot respond to something fake. So that means, this is why putting the result before it is in the wrong context, making a wrong inference. Okay, so because you get pain, that means that the trigger of the pain is true, is real. Okay, so you are thinking about OCD thoughts, about obsessions, you feel the obsessions, you sense the obsessions, and then you get pain. Maybe first fear, then pain, or directly pain. At the end, you get pain. Then this pain considered by your brain as a real, and because this pain happens always after the trigger, after the OCD thoughts, after the OCD obsessions, then through conditioning, okay, conditioning, you can also consult Pavlov conditioning in behavior theory. It is also here applicable. So by conditioning, when there is an obsession and there is a fear, then immediately the brain will understand that, okay, then this trigger is real. This trigger is true. That means for your brain, the content of the obsession is true. And we have always said that the content of the obsession is not only false and not true, but it is 180 degree. It is the opposite of you. It is the opposite of your real feeling. So we want you to get the real feeling when you are approaching your value. OCD, the irony is that OCD, when you are approaching your value, you get the opposite feeling. Okay, you need to be safe when you are approaching. You get safety from your values. You get motivation, you get energy, you get good feelings from your values. Okay? But OCD self, through fear, it lets you feel the opposite of your real feeling. It lets you feel fear and anxiety, pain. Okay? This is always coming after the obsession or after the trigger. For the brain, this is a conditioning. Okay? That means that the brain, we have said, learned during all these millions of years to respond directly to pain and to fear, to respond directly, to protect you. Okay, so he cannot consider such big pain, such a great pain like OCD pain, as a false signal, as a false signal, as an unreal signal. Okay, so he wants to respond. It is very important to understand this a little bit anthropological issue with conditioning, learning issue, learning through conditioning. So this is how OCD try to build its OCD self. The OCD self is built, OCD thought, OCD feelings is built through long term, through scanning, through fear. Okay, so this long term has to do with deprivation from your safety need, from your needs to feel safety, to feel energized, to feel yourself, to feel good feelings from your values. Okay, it is based on deprivation. Why it is long term? It is long term because it doesn't happen at the moment of the trigger or after the moment of the trigger, simultaneously with the trigger. No, it is happening on extended period of time. This is why because you were controlling, you were scanning the environment. You get the first trigger, the obsession, but you try to understand what is this obsession, why I am feeling that, why I am thinking like that, why am I a good father, am I a good mother, I am a good believer, I am okay, am I clean and or contamination. Okay, so you focus on this trigger for a long time, scanning the environment. So this is in extended period of time. Okay, maybe 6 hours, 6 weeks, 6 months. Okay, now we come to the second component. We have said we have two components. First is the long-term component. This is where the OCD feelings and on checking and focusing on the OCD extended for a long period of time. The second component is the sudden or the short term. This is directly after the trigger, after the OCD obsession. Okay, when you get triggered, when you have an obsession, okay, when you have an obsession, at the moment the obsession enters your consciousness. So maybe you had an obsession three seconds ago or 3 minutes ago, but you were not conscious of that. Okay. So at the moment you are conscious of the obsession, this is a sudden, okay, an impulsive moment, then the OCD will collect your brain part that is dealing with OCD will collect all the images, all the feelings, all the sensations, all the thoughts during the extended or long period component, and it will bring it in one spike, okay, in like a dose continuous. So you were the normal is here, but because of OCD you were here, and when you get spike you get there, okay. But in fact not above, but you will get down because it will brings you to the OCD self, and this is the purpose of the fear, of the story, of the OCD feelings and OCD thoughts. It's right, OCD thoughts, then OCD feelings. It tries, and OCD sensations. It tries you to swallow you down, swallow you in the direction of the OCD self. Why? To get this state. Because if you have only OCD thoughts, then there is a chance that you escape the prison. If you have an OCD feelings, then there is less chance that you will escape the prison. But if you have an OCD state, it becomes extremely difficult to escape the prison in the at least now, of course. Okay. So at the moment of the trigger, you you get if you are scared, if you have a lot of fear, then you will sum, or your brain will sum all the feelings, all the thoughts that you have already built in the long-term component. Okay, so it tries to bring you down to the OCD self. Why? So that you will mix with the OCD self. You become in OCD state. I mean by a state more than it is a collection of thoughts, feelings, sensations, memory, history of OCD. It is the OCD self, the collection of all of that. It can also use some images from the amygdala, okay. So the collection of that is the OCD self. When you are entering the OCD self, okay, in the position of the OCD self, we have said, in the position of the OCD self, then everything you see, you think, you hear, you sense is an OCD sensation, OCD feeling, OCD glasses, OCD ears, okay. So this is why it is very important that at the moment of the trigger, at the moment of the OCD, is that you don't panic, you have a courage to confront the OCD. Because the more at the moment of the trigger, at the moment of the obsession, the more you are afraid, the more you will go down. That means the more you will enter the OCD self. So at the moment of the trigger, this is why we say recognize first. This is in the first step. You should never but this is why the the 4 steps are built. We want you at the moment of the trigger. We don't want you to get afraid, to be scared, or to try to know and analyze and overthink the obsession and focus on the obsession, because you will give the obsession food. You are feeding the monster, okay. So the obsession will become bigger and bigger, and you will enter more and more, or in this model of the 3 selves, or the 3 positions of the self, you go down and down and down and down until you are fused in the OCD self, and this is a complete state. Then it is very difficult to escape the prison. Okay, so have a courage at the moment of the OCD obsession. Have the courage. Accept the feeling, the painful, the anxious, the fear feeling. Accept that. Okay, and do not try to understand what is this. What does this obsession represent? Why it look like? Why now it look like different? Of course, OCD comes in many different forms. So now, why? So that you ask yourself, you want to understand. And I have told you, the more you want to understand the obsession, the content of the obsession, the more you will delve in the obsession. So he will swallow you. Okay? So be patient, be courageous, don't want to understand. Leave understanding. Don't try. If you want to understand the obsession, try to understand it later, offline, when there is no trigger, when there is no obsession. You can then use a sort of ERP. This is now, if you are now try to delve in the obsession and to analyze them, now you are doing exposure, the first sum of ERP. And then you stop the even if you don't stop but later you can at least now at the moment of the trigger, don't try to understand the obsession. Don't try to understand the obsession. It is a false feeling, a fake feeling. If you try to understand the obsession, then you will focus on him, you will focus on the obsession, you will feel the obsession, then you are more and more inside the obsession. Okay, so it is one of the trick is that you stop understanding the obsession. Don't understand the obsession. Okay, at the moment of the trigger, you want to understand, you want to study, do the exercises, contemplation, mindfulness. You do it to understand the obsession. I mean, you do it offline, you do it later. Okay, so this is why step one, recognizing or relabeling at the beginning of the trigger. This is why we need step one. Why we need step one? We need step one so that you not get scared, not get feared. Because if you consider the OCD trigger as or the OCD obsession as it's a real thing. So we have said that the brain through conditioning has accustomed that OCD trigger is true. The content of the obsession is true, is real, it is true. What he is saying, the OCD, what is the OCD is true. Why is that? Because OCD causes pain. Now we are telling you. Now you know through meditation, through contemplation, mindfulness, observation, cognitive part of your brain. Now you know that we want to know where does the trigger begins. Okay, we want to know when does the trigger begin. Okay, when the trigger begin, you tell your brain the first step. You say this is an OCD. Okay, so in the first step, when you are saying here it is, this is the OCD. Okay, so you relabel it. You say this is the OCD, or you say this is the fake signal, this is the false brain signal, this is the OCD liar, this is the liar, or like that. You relabel that. This is to tell your brain, okay, that take care, this is not real anymore. This is an OCD, this is fake, this is a fake signal, this is not real. Okay, so try not to be scared, try not to take precautions, try not to okay, this is why step one is announcement that you are now receiving a false signal. You are now beginning to receive a false signal. This is OCD. This is the first step. This is relabeling. Okay. The sixth step, then comes the second step where you say that this is the OCD, this is not me. So you separate, okay, you separate your identity, your real self, from the OCD self, from the OCD, from the fake signal. This is not me. I have told you before that uh, removing the ingredient of I-ness, from the fear will lessen the fear, because the I-ness in uh, the mixing of the OCD with the I-ness, with your identity, serves for urgency. That means the brain will get a signal of urgency. Do quick. You should. This is because urgent. It is me who is getting this OCD content, the false, of course, OCD content. It is me who is getting these fearful thoughts, sensations, feelings. It is me. It is dangerous. It is me. Danger to me. Danger to me. Danger to me. Okay. It is not only danger. You can if you watch television, you will see a lot of dangerous things, but it is not me. It is not on me. It is not to me. It is not done to me. Okay. So in the second step, when you say this is not me, this is the OCD, this is not me, then you are separating yourself from the OCD. Okay. And you accept your feelings. Of course, the feelings still there. Also, I am fearful, or I am feared. Okay, but it will be less. Even at the beginning, if it is increasing, no problem. Keep doing the therapy. This is the only way to get out from your prison, from the OCD. If you try to discover a new thing during the attack, everything you will think is false. You should get the rope. Okay, you get the rope. The rope is the fourth step. The therapy steps, and you get these ropes, and you follow exactly these steps. Okay. Later, offline, I say always. Later, if you want to try new things, you can try new things. But as I have said many times, the most important thing is that you stop the ritual. This is a real criteria to show you what you are doing. Is it good or bad? Okay. So it is very important. Step one, this is the OCD, or you say this is the liar. Okay. So step one, this is the OCD. Step two, this is the OCD, this is not me, or this is not me, this is the OCD. Okay. And step three, immediately you refocus on something that takes your focus, or something related to your value, a goal derived from your value. See you in the next video, and bye bye.